Good afternoon and welcome. My name is Kerry Conley. I am the Director of Programs and Services for the Scleroderma Foundation's National Office. Thank you for joining the Scleroderma Foundation's Patient Education Summer Series. We're excited to have today's session, Telemedicine Strategies for a Successful Visit, premiere as our first event as we launch our virtual university. Today, I would have normally been tracking our conference shipping containers that would have been leaving Boston to cross the country to meet us in Seattle. Our Northwest chapter was all ready to greet us for our National Patient Education Conference as well. However, as we all know, this has been a very difficult year due to the COVID-19 pandemic. But despite these challenging times, we've improvised and adapted and found a way to still offer these important patient education initiatives. Even though face-to-face meetings are so significant in the rare disease space, in trying to find the silver lining in the cloud, we look for the positives. Perhaps this year, we will be able to reach individuals that would not have been able to travel to our event otherwise. We hope you enjoy what we have planned for you today and the weeks ahead. Some quick notes on today's event. The Scleroderma Foundation in no way endorses any drugs, treatments, clinical trials, or studies referenced in today's webinar. Information is provided to keep listeners informed. Because the manifestation and severity of scleroderma vary among individuals, personalized medical management is essential. Therefore, it is strongly recommended that all drugs and treatments be discussed with the individual's physician for proper evaluation and treatment. This webinar is for educational purposes only. If you are properly logged into the webinar, you should be seeing the slide on the screen and hearing my voice. If you have dialed in to the event by phone, please turn your computer microphone down to avoid any feedback. Today's webinar is being recorded and will be made available after its broadcast. We also encourage attendees to use the question chat feature opportunity on the sidebar. Team members from our national staff will be hosting a question and answer segment at the end of the presentation. So let's get started. I am happy to have the honor to introduce today's speaker, Dr. JoAnna Harper. Dr. Harper is a multiple state licensed consult pharmacist specializing in pain management with a personal emphasis in scleroderma and integrative medicine. Dr. Harper received her doctorate of pharmacy degree from Oregon State University and a bachelor's degree from the University of Arizona. She brings a unique firsthand approach to the effects of medication in scleroderma patients with her early childhood diagnosis of Raynaud's, scleroderma, and lupus, along with a host of other conditions related to scleroderma. She has been actively involved with the Scleroderma Foundation since 1994 in different positions. Some of these include her work as a patient advocate, secretary for the former Scleroderma Foundation Las Vegas chapter, and support group leader. Dr. Harper is passionate about providing education, information, and advice in support to the patients to become empowering to be active members of their healthcare team. In her free time, I don't know where that free time comes in, but JoAnna lives life to the fullest by traveling, photography, baking, creating beautiful memories with her young daughter, and spending time with her family and friends that have become family through the Scleroderma Foundation. Welcome and thank you for joining us today, Dr. Harper.
Thank you, Carrie, for those very kind words, and thank you for having me today. I'm really honored to be able to explain telemedicine to you, both from a patient's perspective as well as a provider's perspective. And I do want to thank all of you for attending and listening as well. It's very important, and I really encourage the questions at the end, as well as any type of questions with the contact information at the end. So today we're talking about telemedicine and strategies on how to make it a successful visit. So the objectives today, basically understanding telemedicine and how it is, what it is and how it's used, knowing when and when not to use telemedicine, and we'll go through that in detail, acknowledging the pros and cons of using this type of technology, and giving you a list of all of the things that should be done before, during, and after your visit. And then The goal is you to apply the information provided here to ensure that your visits are successful with every telemedicine visit. So just a little bit about me. As Carrie said, I am a clinical consultant pharmacist, but ultimately I'm a patient advocate, and my goal is to empower patients to become active members of their healthcare team. And again, I am a scleroderma patient and been one for many years throughout college. So everything I learned from a perspective of a patient and applied it as a provider. I do have nothing to disclose. I do work with industry and organizations, nothing that will influence this particular educational presentation. And as Carrie said, it is for educational purposes, and any medical decisions should be discussed with your provider. So what is telemedicine? Telemedicine really is a technology that allows providers to provide patient care from further away. So whether that is from an online portal or an online portal through interactive medicine or a live chat with your provider, or apps that allow you to schedule and communicate with your providers like MyChart, and monitor your own symptoms from home. So remote patient monitoring is very important as well. And those files can be sent electronically over to your other providers so that all of the information is shared and stored appropriately. So the question has been, what's the difference between telemedicine and telehealth? Telemedicine really started 50 years ago in remote locations to broaden access to healthcare, but has become increasingly important with the rise in the COVID infections worldwide. So with the importance and the medical field, we've now decided that this is a great opportunity to use this technology and all the technological advances and the availability with everyone having a smartphone or some type of computer device available, or even just a telephone, as telemedicine is still classified as a telephone visit with your provider as well. So this technology really can be as basic as a telephone, or it can go as detailed as apps designed to improve communication and overall outcomes for health. So there's a variety of uses for telemedicine, and there's on the next slide we'll go through when you should not use telemedicine. So telemedicine is a great opportunity to have just general consults or follow-up visits that don't require a physical exam necessarily. With dermatologic concerns or wound care, which I know is very common in scleroderma, you can send photos to your provider and they can determine whether you need to be seen further or what further action can be taken from home to avoid an in-office visit. Any type of infections, so cold and flu symptoms, COVID testing, to determine if that's appropriate for you. Telemedicine can be very helpful in all of those, as well as any other minor infections. So whether that's skin, mouth, eye infections, anything that's minor and not life-threatening. Another consideration is for worsening symptoms. And that's always a question, I know for me as a patient, but also, you know, many of my fellow patients talking about worsening symptoms, whether this should be worrisome or do I need further follow-up with GI for any type of worsening GI symptoms, or, you know, the pain and fatigue is getting worse. How do I resolve that? And these types of telemedicine visits are very helpful for that. So along with stiffness, the thickening skin, sometimes that can be helpful as well if it's not rapidly progressing. And then additionally, with telemedicine, the advantage to this is really being able to do medication refills and relating anything to mental health and sexual health, and then even possibly new concerns. If you know that a physical exam isn't necessary, then those physical concerns can be helpful. So when to see the provider instead. So with telemedicine, the goal is you see your provider on the camera, and we'll go through this in further detail. But usually there's a camera device, whether it's through your cell phone or a smartphone, or whether that's through your laptop, tablet, or computer. And with that, you have communication with your provider live. So it is live and oftentimes recorded, but that communication usually follows very similarly to an in-office visit, except there's no nurse taking your vitals. Sometimes the nurse does call beforehand and get some information, but no nurse taking your vitals, and just having that communication with the provider. They can do a variety of different physical exams when it doesn't involve touching you via telemedicine as well. So with this communication, the things that are missing and the things that are a little more difficult is when there's any type of emergency. Obviously, we don't want you waiting for a telemedicine visit, and you should see a provider on an emergent basis for any type of chest pain, any signs of a heart attack or stroke, any type of broken bones or lacerations, and obviously dental procedures. I will be more than happy when they figure out how to do dental procedures from home, but I don't foresee that happening anytime soon. So some of the other concerns on when to see a provider, and I did talk to Dr. Tracy Freck about this earlier, and to verify that these are reasons to be seen in person. Any type of major infection, any type of disease progression where a physical exam is needed. So that would be the skin score, potentially, where they pinch the amount of skin that's available to see for skin thickening. And anything else for cardiac, your hearts or your lungs would need a physical exam if there's disease progression and that is your concern. And then any type of fast progression of symptoms. So I'm really concerned if your symptoms are changing rapidly day to day, then that would be a reason to go see your provider versus preferring telemedicine. Any type of suicidal thoughts and actions should take immediate action for those. And sometimes new specialist appointments require inpatient visits, depending on the type of specialty that there are. So the advantages and disadvantages of using telemedicine. So again, it's a video conference call or a telephone call with your provider. So the advantages are it's more accessibility for the patients and as well as for the providers. Oftentimes there's less travel time for the patients, there's less waiting in waiting rooms, avoiding unnecessary ER visits, because ER visits can be very expensive. You don't have to arrange child or pet care. You can have your family present in the room without leaving the house. It really does break down the geographical barriers to care in remote locations, but it also allows specialists out of state, where you would normally have to travel to another state, to see you via telemedicine. So it is one really good advantage, especially with scleroderma specialists, if we can be able to extend this technology beyond COVID, or make this more of a mainstay in our healthcare. So the family can be present and be more involved. They can be there more often, taking notes and asking questions. For the patients who have mobility issues, doing it from their own home can often be helpful. It's often more affordable than, especially ER visits, as an ER visit can be upwards of $2,000 to $3,000. And these are usually covered by a copay, which we'll discuss as well on the next slides. And then less strain on the providers. The providers, some providers have found it to be more helpful, and that they can be even more productive with a lot of the things in office being done prior to. And then the biggest point in my world is the patient engagement, and really engaging the patients by allowing them more frequent contact with their doctor in a convenient way. That means you can ask more questions and get more questions answered. have a stronger doctor-patient relationship, and you can feel empowered to manage your own care with the possibility of remote monitoring as well, to watch for your heart and doing video chats to answer medical questions after a hospital discharge. So telemedicine leads to better outcomes overall. So some of the disadvantages is some people do say it's more impersonal. It's more impersonal. And I will say, when I haven't met a provider and I haven't created that contact with them or that relationship, it can seem impersonal if I haven't met them before. But if it is a follow-up visit, and depending on the provider and their interaction with the video, sometimes there's no difference. So that's kind of a personal thing. And then not being able to monitor the vitals, not having a nurse do your blood pressure and your cholesterol, or your blood pressure and your heart rate, and your blood glucose, your heart and lung function. So, you know, everything that the doctor does when you first get into the room as far as the physical exam, again, checking your heart for any things that may have gone unnoticed previously, or monitoring for any changes in breathing, any infection, looking at various options like, you know, your temperature, which they've always done in office, as well as the blood pressure and the heart rate, to make sure that everything is going well. But also the unnoticed concerns is something that doctors can see regularly without addressing, you know, without actually mentioning that to you during the visit. So providers are trained to notice even the slightest of changes, including the way that you walk, the way that you sit, eye function. So if there's any type of neurologic concern there, and any type of body movement. So is there, you know, the starting of a tremor, things that would not be noticed otherwise. And also, say, the shakiness of your voice or your breath, which sometimes can get missed on video. So sometimes there's some glitches in the video that doesn't always require, or doesn't allow as much viewing for a provider as it would in person. So, and then, you know, you can't do pulmonary function tests, and you can't do the echocardiogram over the phone. Again, I would love for the day when that can happen. But as of right now, further testing may be needed, even after a telemedicine visit, and that you would have to go in for the clinic to do anyways. And then the continued acceptance, as far as right now, it is widely accepted as this is a viable option for us as patients and providers. But will that acceptance continue? And we'll talk about the rules and regulations behind it as well. There is quite a bit of technical training and equipment necessary for the providers, and that can be pretty frustrating, especially for those old school type of providers. And, you know, providers, there have been some setups where providers were seeing other providers' patients, so providers that they've never met before, or patients they've never met before. And I think that that's very important, that the providers continue to see their own patients. And so then they can better understand little nuances, even with a video. So the technology that's needed is usually a video device. So whether that's a smartphone, a tablet, a laptop, or some home computers do have the video capability. You do need a reliable internet. That is something that's really important. And the telephone is available if necessary. Again, that is telemedicine if you don't have a video device and reliable internet. And then any type of monitoring devices. So if your blood pressure is naturally a little high, then, you know, having a blood pressure cuff at home is helpful, not necessary, but helpful, as well as a scale if you have any type of fluid retention, any type of weight concerns. So having that information available to your provider prior to the visit is helpful, as well as your temperature using a thermometer, glucometer, and then any type of EKG device. And we can talk more about that at a later date, but there are a variety of home monitoring systems that I am using in practice that allow patients to have an EKG device at home and the information sent to their provider. So the coverage related to COVID or the extension with COVID and the coverage for telemedicine has been widely accepted with CMS or Medicare and Medicaid services. So they have indicated that the coverage is the same as inpatient, and some states are providing further discounts. So it really depends on the state and your insurance plan. And many states have laws that require private insurances to make this an option that they will pay for just the same as they would an inpatient visit, especially during the time of COVID, where transmission of infections is incredibly high, and we're trying to reduce that infection rate as much as possible. Currently, we do have permission from the Vice President for temporary permission for providers to treat patients out of state. So generally speaking, providers should not see patients that live in another state unless the patient physically goes there, travels there, or the physician is licensed there. So this allows any provider to see any patient at this time, and we don't know if those rules will change. Presumably they will, as all laws are different in each state, and that's why each provider and each pharmacist needs a different license per state. But ultimately speaking, we're hoping that through the advancements that we are seeing with telemedicine and how helpful it can be for our healthcare, that some of those permissions can be extended. And since again, this is it's been around for 50 years, but due to COVID, it has improved significantly, and it has been widely accepted in the last couple of months for telemedicine to be used. There are constantly changing policies, unfortunately. So right now, insurance is covering it, and the states are allowing it, and it's substituting for an inpatient visit when possible. But ultimately, it is, a better idea to follow up with your insurance prior to the visit to make sure it is covered. I know for pharmacists in particular, we're not always covered on insurance plans, but that is improving every year. So hopefully in the near future, you will be able to access a pharmacist in the same way. But the question is going to be whether they're going to allow the same access to telemedicine and the coverage to telemedicine as they do now once COVID is better controlled. But as of right now, COVID's not going away as quickly as we would like. So we have quite a bit of time ahead of us. Regarding privacy and security, this is really important. So the Health Insurance Portability and Accountability Act, as you all know it as HIPAA, protects your privacy and the security of your health information. This was amended to allow for providers to begin using technology quicker during the COVID epidemic. So the Office of Civil Rights has analyzed and ensured safeguards are in place. They recommend safeguards to be in place for these particular applications. So the applications that we know have the safety measures in place are Google Duo and G Suite Hangouts, Zoom for Healthcare, Skype for Business, GoToMeeting such as this one, Doxy.me, which a lot of independent providers use, Cisco WebEx, UpDocs, Amazon Chime, Spruce, Healthcare Messenger, and VC are all ones that the Health and Human Services has deemed safe for using telemedicine. If you want further information regarding the safety of the telemedicine, there's the website there for you, thehealthit.gov and then /telehealth. And because it's using a certain application, it is that application's responsibility to make sure your information is safe and that all the safeguards have been met. There needs to be an agreement with the providers or their systems have agreements that the video chat software that they're using to host is receiving, maintaining, and transmitting your electronic health information appropriately and safely, and they have a backup plan if there is a breach to make it to where your information is not readily available. So if you have any questions, make sure you contact your provider's business office. And for your information, oftentimes your visits are recorded. So if you are concerned about that, I would discuss that with your doctor's office or the business office at your provider's location. So with any computer device, there's always technical difficulties. So my husband works for medical IT, and I got a lot of his input here, and as well as a variety of providers and patients. So here's ways to avoid the technical difficulties that are possible. First and foremost, checking for reliable internet and reception. So whether that's internet through the computer or whether that's the reception on your phone, sometimes you may have to change to cellular data if you're not in a good reception area using Wi-Fi. Make sure you read the email, letter, or your provider's website before the appointment to make sure you know how to log in. They should have a button for you to push to get you into that login site, and it should bring you directly to the provider. But make sure you read that ahead of time, so if you have any questions, you can make sure you ask. And try out the app prior to your appointment. So they do have a test option available. Make sure you do try it out. And make sure you unblock your restricted or unknown callers. I don't know about you, but the sales calls are increasingly annoying. If you haven't received these types of calls in a while, you may definitely want to check this out, because I've provided the settings for both Apple and Android. If these do not work, please contact your cell phone provider, your phone company, or the newest child or teen or millennial nearest you, as they will be the ones to know how to turn that off. But I know personal experience, it was turned on and I didn't even know it. So things that you just don't think about. Make sure you have an appropriate stand or a prop device. They want to see more than your eyeball and your forehead. So, and you will want to take notes. So a phone or being able to prop up your phone or your laptop or your tablet would be helpful without holding it. Other ways to avoid technical difficulties, and it sounds pretty simple, but answering the phone around your appointment time, even if you don't recognize the phone number. Oftentimes that is your provider's office calling, but the way it's routed, it doesn't come up as your doctor's office directly. And then for sound quality and video quality, make sure you call from a quiet, well-lit room, and make sure that you have all the information that you need in front of you, and then know how to adjust the volume on whatever device that you're using. So how to prepare for your visit. So weeks before, and I encourage all of you to do this regularly, but document your symptoms, any type of nutritional content, any activity that you have, medications, and particularly any changes. That way you can give a better account to your provider on what is going to be most important to you to discuss in a short amount of time during that visit. And then also make sure you complete any paperwork that your provider has sent to you prior to the visit. So, and return it back to them so that they can have all of that information read prior to your visit to be as effective as possible, but also to address all of your concerns. They usually do have access to your chart, but a good habit to get into prior to is looking at all the various options that or all the things that you have gone on in your life, and make sure that they can discuss that and you can discuss that with them and everybody's on the same page. So the day before, you would practice logging into the app, like we discussed, to avoid any technical difficulties, making sure your phone is unblocked, and making sure your stand is available, making sure your pen and paper are ready. Review the login instructions from your provider and know how to adjust the volume, and then prepare your list of questions and concerns in the order of importance. Oftentimes, they are still limited with the amount of time that they have for each patient. And so making sure that they are in the most important being first, that way you can get what's most important to you taken care of. And at the day of the appointment, make sure you check the internet connection and change to cellular if needed. Find that pen and paper that my daughter would have lost by now already. And review the list of questions and make any adjustments. So is there anything that has changed or anything else come to mind in the last day? Monitor your blood pressure and your weight, temperature and blood glucose if you have those things available so that you can provide that information to them. Answer the phone around your appointment time as we discussed and call from a quiet, well-lit location. And then during the appointment, be direct and express your concerns. Make sure you request any refills that you would need up front. Have your medication bottles ready and nearby so that you can tell them what you're on, or if they have any questions, you can read the bottle and you can tell them exactly how you take it. Mention any type of new lab work or any medication changes, whether that's prescribed or not. I know we're all patients, but we need to have open and honest communication with our providers about any medications we may have changed or that other providers may have changed. And then any other provider visits that you've had. They do have access to your chart, but sometimes, or most of the time, they have access to your chart unless they're from a different system as another provider that you've seen, as we all can't share notes, unfortunately, yet. I know that's a big push in government, but we are not quite there yet. But it is a good habit to get into to make sure that you mention anything new to providers at any visit. And then have your family available to listen and help take notes. Any notes that you have, make sure you address questions and concerns at that time. Set up your next visit, and then make sure you leave with a plan. Make sure that this is a plan that you and your provider has come up with, and you're all in agreement, and you know what to do next. And then please be patient with your provider with technical issues. I know this is new for a lot of providers, but it is, a lot of technical issues on their end, so please be patient. And then after the visit, as with any other visit, follow up with the recommendations. And yes, you are now exhausted from doing everything that we had you do prior to the appointment and during the appointment, but it is really important to follow through on making any further appointments that are needed, any lab work, and making sure you pick up your medication. As a pharmacist, I cannot stress that enough, that usually they do want that taken care of sooner rather than later, but also addressing any issues that you may have with getting that medication covered or availability, whether that's, a medication that's out of stock. So making sure that that conversation is being had quickly. And then the hardest for all patients, which I wholeheartedly agree with, is to start making those changes to make that plan successful. So ultimately, give a day to recover, process all the information, but get started the very next day. So this is a checklist from the PHA, the Pulmonary Hypertension Association. Similar checklist for telemedicine. Most of this I've already covered with you. I will have the checklist that I just provided to you available to carry to put on the website for scleroderma, so you can print it out there as well. So in conclusion, telemedicine is really a convenient, safe, and affordable option for our healthcare today, especially to reduce the risk of COVID infections and to improve the accessibility in being able to create that care that we so hope for our patients. Do not use telemedicine for any type of medical emergencies or where a physical exam is going to be needed. Oftentimes, we've been to the doctor enough, we can start to predict, and if not, call the doctor's office and ask them what they would prefer in your situation. Do use telemedicine for routine follow-ups and minor concerns to help increase care and increase the outcomes that you get from this. Check with your insurance provider to verify coverage if there is a question. Complete the checklist provided in the slides starting weeks before your appointment so that you are fully prepared to make that a successful visit for each and every visit. And so with the use of technology, better communication and better outcomes are expected. And that is our overall goal in healthcare. So I want to thank you all for listening to all of this. And these are some quotes that are very important to me as a patient after 20 years of experience. And I wish you all hope and happiness as well as health. There will be questions at the end here. If you have questions, please put them in the comment box. And I am available for any type of pharmacogenomic, nutrigenomic, or medication consultations. And my contact information is there. So I'll open it up to Carrie for questions.
Yes, well, Dr. Harper, thank you very much for that detailed overview of telemedicine, and thank you so much for providing a number of strategies so we can all have a successful visit. As Dr. Harper just mentioned, please utilize any questions that you have on the question field on the sidebar. It looks like we do have a couple of attendees that have taken that opportunity to ask a few questions. We have national team members from our office, David Murad, Director of Chapter Relations, and Angel Soto, Programs and Services Associate, here to facilitate our questions and answers segment.
Hello, everyone. Angel here. Thank you all for attending, and thank you, Dr. Harper, for that wonderful webinar. We do have a few questions. I'll go ahead and open up. So one question we received was, do you think that telemedicine visits are going to continue going forward? Or do you think that patients will be going into the doctor's office again like we used to?
So we are all hoping, patients and providers alike, that this will continue. This is, again, it's been around for 50 years. So we just underutilize this technology. So now that we know that this technology can make our lives better, both providers and patients, and actually improve our healthcare system, I have a feeling that they're going to stay. I am a telemedicine provider, and so I don't plan on changing that anytime, really anytime. But what it comes down to is expressing those concerns to both legislation, your Congress, so on and so forth, if there ever is talk of decreasing it. I think the bigger question is going to be is whether it's advantageous to insurance companies as well, which I know it is. And they're going to be a bigger push to keep this running. So I feel that it's going to continue regardless in various formats. And I think that we're going to get better with healthcare technology and information sharing when it comes to your patient's, your chart and your medical information. So I think this is just our takeoff point for our healthcare system to change and evolve.
Thank you. Another question we received was, having a rare disease means our primary physicians, our rheumatologists, are sometimes feel like the only physician that really knows what's going on with us. If we're not able to get a telemedicine appointment with our primary rheumatologist or so forth, is it still worth it to get an appointment with whoever's available?
I would say yes. And the reason being is they can share with you whether they feel it's an emergency or not, and whether a quick follow-up is needed. So they can answer a lot of the questions. I completely understand that our scleroderma specialist is our go-to. And for those that are lucky enough to have them, we do rely on them very heavily. But in the grand scheme of things, your primary care provider does communicate with your rheumatologist. Hopefully they have really good notes from your rheumatologist regarding any type of emergencies or concerns. And then also encouraging the rheumatologists to kind of get on board with this as well to help save time and money for our patients and for you guys to make sure that we are getting the care that we need in a timely manner And I think they could use telemedicine as well. It's just a matter of time, and I believe they will adapt this technology as well.
Thank you very much. Next question would be, you mentioned that there may be time constraints for some of the physicians. What if we run out of time, but we still feel there was a lot more we needed to ask? Is telemedicine something where we can call them back, or they can schedule us more time later in the day, or is it kind of once you end that finite amount of time, is your appointment over?
Yeah, that's a great question. So oftentimes with any other appointments and scheduling, just like inpatient, a provider allots X amount of time. And sometimes that's 20 minutes, sometimes that's 30 minutes, sometimes it's more. But oftentimes it's usually only 20 to 30 minutes. So in that time, that's the reason the importance of having that list in order of what is most important being the first. To discuss with them certain applications. So I know that MyChart has that available option to ask questions of your provider if you just had a visit with them. And oftentimes that's for no charge. And so that's where I would add the other questions there. Or I would, usually they do prefer electronic form if you can, rather than calling the office. But the other option is calling the office afterwards. But what I would do is I would ask the doctor right before letting them go how they would prefer to get those further questions. Oftentimes they will transfer you back to a nurse or have a nurse call you back to make another appointment. And because it's a little more efficient for providers to do telemedicine, they can often fit in a few more visits a day with this type of technology. So sometimes they have earlier appointments, or they are questions that a nurse can answer as well, or a nurse can just give you back the answer once the doctor gives it to them. And so that would be the most appropriate way to do it. There are a variety of apps coming out, and my service will have one of those apps that can ask questions directly to your doctor. And so that is becoming very popular, and we're hoping that in the near future, a lot of, or most doctors will have that option.
Hey, Dr. Harper, I have another question. You mentioned that interstate care for a patient and doctor being in a different state may not be covered under telemedicine guidelines. What if you're already a patient of record with a specialist in another state, and many scleroderma patients travel across state borders to see scleroderma specialists or to be seen at a scleroderma center? Do you have any insight about that?
So yeah, so I tried to, I don't think I explained that well. So if a doctor's license covers that doctor for that state. So if you are seeing that doctor in that state, then it is covered, even though you do not physically live in that state. And that's why they still have to have you come in to see them, unfortunately, to travel. We're right now during the COVID epidemic, that rule is gone. And so currently, those doctors that are in another state can bill for a visit, a telemedicine visit out of state for you now. So that means that we have more access to our providers, even if they're across state lines. And so most of the providers, I know there's a number of us who are hoping that there does become more national guidelines for providers and pharmacists rather than state by state, but we're not there yet. So we're hoping that that can be extended with COVID when it comes to telemedicine, but that's going to be between the American Physicians Association as well as the variety of other factors that are involved. So there's going to be a lot of talk in Congress about that coming up. So we're hopeful. Hopefully that answered it.
Yes. So this was a bit more of a tip, but if you could expand on it, So this individual, their doctor advised them to use smartphones for their telemedicine visits because it gives them the ability to really zoom in to certain areas of the body, and they can use their flashlight and other things like that. So that may help the physician,
Excellent.
with that appointment. Are there any other tips that you'd suggest with tools?
The cell phone is a really good idea. I try not to make that a mandatory option because some people do not have smartphones, and I know they can be very frustrating for people when they're new at it. But some of the other tips, I tried to purge everything I could think about into the checklist. But ultimately just having that open line of communication with your provider and being as informed and as prepared as possible. So even more prepared than an office visit. So really it's taking that responsibility in your healthcare to really take control and express what your concerns are and what you need up front so the doctor can allot enough time for any questions and so on and so forth.
Thank you very much. Let's see.
Yeah, there's another question. Are there any type of apps for a phone that would help provide accurate health information to physicians through telemedicine?
Yes, there are a variety of apps that are very helpful. The question is what system or what app or program is your physician running? So as we all know, there's a million different apps out there and a lot of different technology that's behind the scenes, and those apps have to communicate appropriately with the program that your doctor is using. So the integration is a question. So asking your provider and digging a little bit more into, or even talking to the business office at your provider's office to see if there are apps available. I do know that I run a few apps with mine, and one is Oxvibe Body Metrics. So OXVIBE is one that I run, and it communicates with some providers, but not others. Body Metrics, so BODIMETRICS is another one. Those two I use, and I actually do have remote monitoring systems set up, and they're things that we can help provide to the patient with a lower cost, and that can send all of that data, including EKG results, to your provider.
Thank you very much, Dr. Harper. I guess next question is, so I'm not very tech savvy. I don't use Zoom or many of these other apps. Do you think telemedicine is still a good option for me, or do they have anyone on staff that can help me with this process?
Yes, so they do. I do think that it is an excellent option for you, even with not having as much tech information. With the reason being, there are people in the office that can help. So oftentimes the nurse will call you ahead of time to make sure that you're set up before the doctor calls. But you can also call the clinic and make sure that when you have questions, run through it. So as long as you can receive that email, that's going to be most important, is receiving that email and clicking on the link. So that's usually the hardest part, and everything else is done on their side. So oftentimes it's not hard. And again, that's why I have you try out the app prior to make sure that there's no issues or concerns and that you can call the office with any types of questions. But they do try to educate, they try to make it as easy as possible for patients to follow with no technological background whatsoever. So they expect that.
Thank you. Let's see. So we have one more question. What should I do if I'm experiencing technical difficulties and unable to communicate them to my physician?
Okay, so if you're having technical issues during the call,
Yes.
if you've completed the checklist prior to, it decreases that possibility. The other possibility is while they're on the phone, if there's a video concern, then that's usually reception. So going to a different area, hopefully that you have that area established that you know you have good reception, or changing it over to cellular data instead. So those are two options for visual, sometimes with audio as well. And then the audio is making sure that you have the volume up and down and know how to use that prior to. But additionally, making sure that the doctors are aware of this and the doctors know that this is often the case. So if it's just something that cannot be fixed, then they'll just reschedule you for another telemedicine visit or an in-person visit if they can't fix it within the first 5 or 10 minutes.
Thank you so much, Dr. Harper. That was our last question. I'm going to turn it back over to Carrie. Thank you.
Excellent. Thank you, David and Angel, for fielding those questions. Great questions, great dialogue. Looks like we are just approaching the top of the hour. Dr. Harper, any parting comments as we wrap up today's session?
I just wanted to say I thank you all for being strong scleroderma warriors and keeping the hope alive. And I look forward to presenting the CBD and THC talk later in the summer. And I look forward to seeing you all then.
Excellent. In closing, I would like to thank Dr. JoAnna Harper for being such a champion of our mission and for sharing your time and expertise with us today. Thank you to all the attendees that logged on or dialed in today, and a special thanks to our Diamond National sponsors, Actelion Pharmaceuticals US and Boehringer Ingelheim, for making today's webinar possible. We'll be hosting the summer series webinars weekly. Next Wednesday, July 15th, we will have our very own Medical and Scientific Advisory Board member, Dr. Jessica Farrell of Albany College of Pharmacy and Health Sciences, speaking on scleroderma medications. What works and how can I get it? Please stay tuned and connected with us through our website, scleroderma.org, and social media outlets to stay informed on our virtual university patient education summer series, as well as all the great chapter virtual events happening now across the country. This will conclude today's webinar. Be well and have a nice day. Take care.